Hi, this is Nicole Kutchuk, and welcome to 10 Minute Tidbits. Today, I'm here with Scott Nevers. How's Scott? How are you?
Doing well. How are you?
And you might be wondering who these other guys are. Well, here's the story. Scott, at the age of 27, had a cardiac arrest and survived. This is the team that saved him. How cool is that? Let's chat. All right, so Scott, how are you?
Doing well. Doing well. How are
So
you?
at the age of 27, you had a cardiac arrest.
Yeah.
That is not exactly the type of broken heart we expect at the age of 27, right, guys?
That's right.
What do we expect? Some woman sloshing
That's
your heart
right.
apart, right?
That's
Yeah.
right.
Yeah.
Turn it out.
This one legit took me down for a while.
Yeah. Okay. So let's what happened? So tell us your story.
Yeah.
So when you were in high school.
High school, just like any other high school kid, athletic, played every sport. I started experiencing these palpitations where it was hard for me to see, it was hard for me to breathe. My heart was beating through my chest. And I just remember telling my mother, "Hey, something isn't right." And so
you knew.
I knew something.
Yeah.
I knew that wasn't right.
Yeah.
I'm just glad I didn't ignore it.
Okay.
And then we went to the cardiologist and got a Holter for 24 hours. So we were able to catch it that next day. I had practice again, hockey practice, and I was able to catch it and actually record it. And then it was sent into the hospital, the doctors, and within 20 minutes they called me and they said, absolutely stop everything you're doing.
Yeah.
So
you were having runs of ventricular tachycardia, basically.
Yep. So
Which is
basically,
scary,
they were
right?
kind of
Yeah.
impressed, or they were telling me that they were surprised that I wasn't dead at that point.
Wow,
After
okay.
those readings, they were that severe.
So you had your Holter. You're having ventricular tachycardia. Now fast forward
Yep.
to age 27. What happened?
Yeah. So it was just any normal day for me. It was middle of the summer. It was playing golf and playing softball.
Super active.
While obviously watching what I do. And apparently that day things didn't go well,
Okay.
to say the least. I was playing in a men's softball game in the city of Biddeford. It was a league that I was playing in for the last 3-4 years.
So you're from Biddeford, Maine.
I'm from Gorham, but Biddeford is about 20 minutes
Okay.
south of Gorham. So
Got it.
it's Maine. Everyone knows.
Okay.
We're all pretty. It's a small town,
Okay.
small state. So, yeah. So we were playing softball, and everything from that softball up for a couple of weeks are all basically stories that I heard because I don't remember it. So
You
I had
have
a
no
cardiac.
memory.
I had a cardiac arrest playing softball.
Okay. So Rob, actually, would you guys mind introducing yourself to the audience?
Absolutely. My name is Rob Mertz. I'm a paramedic with Biddeford Fire Department.
I'm Kevin Duras. I'm a deputy chief with the Biddeford Fire Department as well as paramedic.
Tim Sivney, paramedic, City of Biddeford.
So Rob, you actually were the first responder. So you were the lead medic that day.
Correct.
And you get this call. So what was the dispatch call?
So we were a little short-handed that day. We had some people out doing other things, and we got a call for an engine and an ambulance to respond to the softball field for a male patient in his 20s that's having a seizure. So it got called in as a seizure.
So isn't it such a different way of thinking when you're thinking you're going to treat a seizure and you get there and...
And we pretty quickly recognized, as I pulled
Not
up,
a
I was
seizure.
able to pull up right next to him in the parking lot. I knew very quickly that this was not a seizure.
Oh, wow.
And
Yeah.
we wanted to treat him pretty aggressively. So I reached down, felt for a pulse. He did have a pulse at that point, rapid weak pulse. We were right next to the ambulance, and we had a crowd of about 30 people on scene, all huddled around, understandably concerned for Scott. So we made the decision to get into the ambulance very quickly. By the time that happened, I got him on the monitor, and he was in VF. So we started our ACLS from there.
Yeah, okay. And you all worked on him for quite a while, right? So you also came to the scene. So tell your story.
Sure, I did. I was at my in-laws having a barbecue at the time, and it was maybe a quarter mile down the street from the ballpark where Scott was playing. Like Scott said, it was the hottest day of the entire summer. It was upwards of 112.
Which for Maine
degrees.
is...
For Maine is very
Too
warm.
much.
Yeah,
It's
very,
really
very
warm.
humid. And,
Yeah.
So we all needed to kind of look after ourselves and hydrate properly.
And you were at a barbecue.
I was at the barbecue.
So what were you hydrating with?
I was
Water?
I was hydrating with water and soda, and then I was getting ready to open my first adult beverage.
Okay, good. So it got you before you had an adult beverage,
Absolutely.
all right?
So
Okay.
Timing was good that day.
it was
for you.
perfect.
Yeah.
It was perfect. So when the call came in, it sounded like an ordinary call that required, and our response would be an ambulance with 2 people, and then a fire engine that would have an additional 3 people.
Okay, so usually 5 people.
Usually 5 people
Okay.
initially, and then if the call escalates, if it's more higher in acuity, then we would send the majority of the crew, if not the entire crew.
Okay.
But of course, as things would be, many of our members were distributed throughout the city doing other things at the time, handling other calls as well as taking care of other issues that were going on in the city. So my response was in a personal vehicle after the call from Rob to say that it was in fact a cardiac arrest.
Yeah.
Which would certainly require more people to be able to
Absolutely.
perform the CPR and other procedures that need to happen.
Yeah. So you worked on Scott for a while. How many times did he get shocked?
Yeah, around 20, somewhere in that neighborhood.
Wow. 20 shocks. How did your chest feel after that?
Didn't really quite feel that at the time, obviously, but
Yeah.
when I woke up and kind of got moving a little bit, it was a couple burns there.
So you had some
a little sore.
Yeah, some burns to your
Yeah.
chest from the pads. Okay.
And if they save me, I don't really care what my
Yeah,
chest looks
you
like.
can deal
so,
with
yeah.
chest burns. Now, what you resuscitated him for a long time. What made you keep going?
Well, clinically he had improvement with his rhythms. It took a while to get the improvement, but he's had course VFib for quite some time. We probably gave him 6 to 8 shock therapies before we got a pulse back and an organized rhythm. I think it was sinus tach. And then he degraded into VTAC with no pulse, but I would take VTAC over VFib any day. So
Yeah.
we were able to work him back, and then between getting him back the second time, then he would just have rhythm changes with a pulse, so I was able to cardiovert him out of those each time successfully.
Yeah. Okay.
So that's where we really got a lot of our shock therapies in probably 5 minutes or so with all the cardioversions.
Okay, and then you transfer him to the hospital, and then you're in the hospital. You actually got cooled as well.
Yeah.
So you were in you said a coma for quite a few days.
Yeah, they put me in a medically induced coma for, I think it was like 2.5, 3 days,
Okay.
just to obviously protect, the organs. And from what I was told, they tried to take me out of it and the first time and wasn't having any of it, so
Okay.
they had to put me back in. And so I think I was in a coma for about 3.5, 4 days until I
Yeah.
finally woke up. And again, still don't remember anything in the hospital,
Yeah.
but luckily here I am with no brain damage. Like I said, depends who you ask.
He has no brain damage, just so you guys know.
Just so
so,
depends who you ask. Some people can say I have brain
Yeah.
damage.
Yeah, so anyway. Yeah, and what is that like for you to basically have lost at least a week of your life?
Best nap of my life.
Okay, all right. So
It is.
have
what
you
it is.
struggled with losing that time, or have you pieced it back together?
I hear, like I said, bits and pieces of what happened,
Yeah.
and for the most part, I'm glad I wasn't there.
Okay.
Just a lot of stuff. The picture of me. Someone took a picture of me when I was in the coma, and I'm glad I wasn't awake. I remember any
Yeah.
of that stuff. I mean, literally anything that you could hook up to me, I was hooked up to.
Yeah. Was it helpful for you? And I'm asking you this from the perspective of all the listeners out there who work in critical care. Was it helpful for you, though, to have a picture of you on the ventilator and you had like the cooling device on you just to see what you
enjoy
look
it.
like?
I like it.
Yeah.
Personally, I like it because it just shows. I mean, not that a cardiac arrest isn't a crazy event, or being in a coma isn't a crazy event, but it just kind of shows you how, like, holy crap, this is what I went through. This is just a fraction of what happened of that, over the span of those 3-4 days. And it puts things in perspective for sure. I mean, I'm always laughing. I'm always trying to have a good time. It's very hard to get me mad. And you just look at that picture. It just reminds you, holy crap, it could have been a lot worse.
Yeah, no, absolutely. Okay. And then, so you have your arrest, you survive.
Mm-hmm.
Did you get an ICD placed like you were originally told to?
Finally got an ICD in. Yep.
Yeah.
So
And
yeah,
tell a story about your pediatrician.
So in high school, I was actually suggested to get an ICD after we found out that I had VTech, and the stubborn me, and decided to say no, mainly because they said it could accidentally go off, and it feels like a horse kicking you in the chest, and
Yeah.
I didn't really want a horse kick me in the chest, so I said, you know what, I'll just I'll watch my activity, I won't play sports, but I don't want the ICD.
Mm-hmm.
And it took a few appointments of him trying to convince me to get it. He drew it out. And so after I woke up from my cardiac arrest, I actually do remember my pediatric cardiologist coming in and just kind of looking at me and says, "Hey, told you so." And,
Told you so. There you go.
something
right?
along those
Yeah.
lines. But,
Yeah.
I couldn't blame him. I would have done the same thing.
Yeah. Well, I mean, I'm
So-
sure he's worried about you. Yeah. So okay.
Yeah.
So you had your ICD placed, and
Yeah.
how's that go? How's life with an ICD?
ICD is it's good. It's there when I need it, and I haven't had it accidentally go off, but it has gone off twice. And
When you needed it,
yep, I was doing
Okay.
things I probably shouldn't have done. But
like exercising.
I was
Playing
playing
sports?
floor hockey when I wasn't
Playing
supposed to, and then the last one, I was actually reffing hockey. So reffing hockey was my last ditch effort to do some sort of sports or exercise of something that I enjoyed.
Yeah.
And when hockey is totally different, but when you ref, you're not skating as much.
Mm-hmm.
But the condition I have is a progressive condition, so it was just a matter of time before.
Yeah.
So yeah, it's gone off again there. So
Yeah.
hasn't since. I haven't done anything. I just golf and enjoy the main winners and
Yeah.
complain that it's cold and snowing. I don't do anything else.
Now you guys were
Take
all
a power
local.
cart.
Yeah.
What did you say?
Take a power cart when you golf.
Right.
Yeah. I
You
take
can
a-
walk.
I always-
That's the way to do it,
I always
right?
take
The
a car.
caddy.
I agree.
I
don't know how
never
to do
walk.
stuff.
I never walk, and actually since then I never walk. I always take a cart. I make sure I always at least with somebody else. I won't go out and play golf by myself,
Yeah.
and I know I'll be fine.
Mhm.
No, but still,
Yeah.
just a little. I don't know. Once you have one of those things, you just it's always on the back burner.
Sure. Yeah. Now in Biddeford, Maine, you guys are like local heroes, right? You've made the news.
We'll have to say that we do our jobs and we do them well,
Yeah.
and we certainly take great pride in them. But heroes, no, I mean,
Okay.
we do what we need to do, and
They're
we do what we're
heroes.
trained to do.
They're heroes, yeah. So
Um,
take it from this guy.
Yeah.
This guy says you're heroes. Yeah.
Depends who you ask.
Yeah.
To them, it's just a job, but for me, it's more than that.
Yeah, their actions saved your life.
Mhm.
And you guys have all become friends, right? Since
Yeah, we've been really fortunate in
arrest.
his case because oftentimes in EMS we don't get to really follow up that much, or at least nowhere near have the personal relationship we have. So he stops by the station, we have him in.
I know when I was first ready to go, I was like, we gotta go down to Biddeford. Because I remember when I got out of the hospital, I wrote like a Facebook post. I'm like, does anyone know who was on the scene of that?
oh,
And
because you
that's-
were trying to connect the dots
And
and,
that's
who was there.
and that's how
and-
we pieced
Uh-huh.
together this person, this person, this person, and
Yeah.
so yeah. I mean, it was the first thing on my mind when I was was able to think straight. I guess.
Yeah. Yeah, just
but, yeah.
finding who.
Yeah,
the
trying to
team
figure
were,
out who
yeah.
was there, what was
Yeah.
going on. Because again, I don't remember any of it. So this was
Yeah.
like a big adults game of Blue's Clues. We're just trying to piece together, the,
Right?
trying to figure out the puzzle here. What
Yeah.
happened?
Yeah, and Tim, so you've done a lot of work with educating. So you're the educator for.
I do a good
Biddeford.
part. I do a good portion of
Okay.
the education for the city.
Okay, and so tell me, like, where have your efforts gone now?
Well, let's start with this. I mean, this is an awesome story for educating our own. I mean, in EMS, we talk about, communication, teamwork, and training. Those are the most important things, and that's how we get our success rate high. Looking at the successful stories, looking at the stories that are not so successful, and building off of that and making it better. Evidence-based medicine, right? That's a big part of
Yeah.
what we do. And then obviously we have the public educational part of it, where I teach a lot of CPR classes, heart saver classes to the public, and I teach a lot of BLS classes for all of the people that need a renewal or refresher, right? They have
Okay.
to have a CPR class for work. So with the public, the biggest thing is we want them to come take the class because anyone can do CPR. Anyone can learn the skill of CPR. It's a very important skill. Because what do we talk about in CPR class? What do we know from the HA? If cardiac arrest is witnessed and someone bystander CPR started, it improves the chances of survival by 50%.
Yeah.
That is a huge number, and it's, education is a big part of that with the general public. And the biggest thing with the public when we teach their class is if you're not sure, do it.
Yes.
We talked about
Uh-huh.
agonal respirations. If you're not sure, do it. And doing something is better than nothing at all.
Yeah.
And that helps us in the chain of survival for us to get there and be able to continue from that point. And a lot of times it makes a difference now. We're seeing improvements because of that.
Yeah, wow, okay. Well, I just want to thank you all for coming and sharing your stories today. Scott, I'm so happy they resuscitated you.
Oh,
You're an awesome guy.
Thanks to us.
We are too, because if they didn't resuscitate him, we wouldn't be here. So
That's
This is how these guys
that's
are.
right, yeah.
These guys are always having fun together. So anyway, but this is Nicole Kupchik, and this is 10 Minute Tidbits.